start the camera, and if y'all want to just start talking a little bit. And what I can do is I can cut pieces of it out that are the most informative. So if you want to say, let me say that again, it can all be edited out. So just as casual and, just like you're telling her what's going on with Aiden, and, just that would probably be the best, don't you think?
So since I don't have a mic, you can cut me out.
Yes.
Okay.
And yeah, just let her finish completely before you start talking so that her voice doesn't pick up in the mic.
Okay.
Thank you so much. Okay.
So Dr. Warner, would you tell us what your name is and a little bit about your background at UAMS?
Well, my name is Dr. David Warner, and I am an associate professor at the University of Arkansas for Medical Sciences. I completed my medical training in St. Louis and a residency here at UAMS at the Jones Eye Institute, followed by a fellowship in cornea and external diseases at the University of Florida in Gainesville.
How did you get involved with arterial tortuosity syndrome?
I became involved with arterial tortuosity syndrome through our genetics clinic. We have an outstanding and somewhat unique clinic here where we see patients with rare diseases, and that's how I became introduced to Aiden and his condition.
What did Aiden and his mom first come see you for? What was the problems Aiden was having?
So Aiden had noticed a steady decline in his vision over a process of a few years. And he was seen by an outside physician who noted that he had increasing myopia and some corneal opacification. And so we wanted to see him to characterize the severity of his condition and see what kind of treatments might be available for him.
How is Aiden's, since you first met Aiden, how is his prognosis? What has he had done at your clinic, and any treatments or anything that he's had?
Well, the first thing we did for Aiden was to establish the severity of his corneal thinning. Because he has keratoglobus and his corneas aren't as strong as other people his age, then his corneas tend to bulge, and that weakness causes increasing myopia. So we did some scans to assess how severe the opacification and the myopia were, and then we talked about a unique and new treatment called cross-linking. We referred Aiden to Dr. William Trattler in Miami, Florida for an evaluation with the hopes that he could receive cross-linking, which would essentially freeze his corneas so that they would not continue to steepen and worsen.
What exactly are the corneas, and why are they important in the case of ATS?
So the cornea is the front part of the eye. It's kind of like the windshield of the eye. And if it's not clear, then of course it affects the vision. So in ATS, we've noticed that these patients have weaker tissues, or more elasticity, if you will, of some of their tissues. And when that occurs in the cornea, it's susceptible to bulging and becoming misshapen over time. So Aiden was evaluated to see if the cross-linking procedure would basically halt the progression of his disease and allow him to keep the vision that he already has.
Have you seen Aiden since cross-linking, and do you think it's a positive way to treat kids that evaluate the same way that Aiden has?
So I just barely evaluated Aiden for his 6-month follow-up, and he is doing great. We took a corneal map of his, we obtained a corneal map which showed us that his steepness and the degree of astigmatism has been totally stable since the procedure. That's really encouraging and exciting. It seems to indicate that the procedure worked in this case, which was unknown. We know what the procedure does for normal corneas, but we had no idea if it would work in Aiden's situation.
Have you seen any other ATS patients or carriers of ATS?
So we did something unique at the University of Arkansas in conjunction with Arkansas Children's Hospital. We established a clinic for ATS patients and their families so that they could come and be evaluated, and we could try to classify the characteristics of this cohort. In conjunction with that clinic at the Jones Eye Institute, we established an eye clinic for ATS patients. We examined 7 patients, 5 of which had ATS, 2 of which were carriers, and what we've tried to do is classify the abnormalities in such a way that this information might be useful to other patients and families with ATS.
We know that you're a specialist and you specialize in corneas. So, what would you tell a regular eye? Sorry, I got to start over. I don't know.
You're fine.
What would you tell a regular eye doctor if they see something they're worried about, or what would you suggest? Now I'm messed up. Now we had a good roll going. What
You're
is going
doing
on?
really fabulous.
You are
with-
doing
With
fantastic.
coming back with, saying what she's saying back,
Yeah.
so that we know you're doing awesome.
And I'm trying to leave it open so you can tell
Yeah.
me what parts. So what would you tell another physician that sees a patient like Aiden in clinic?
I would say that all ATS patients need to have an annual eye exam. Some of them will have weakening of the cornea, which can lead to keratoconus or keratoconus-like condition. Some of them, like Aiden, develop the weakness of the cornea early on, and we call that keratoglobus, and it can be a more severe issue. But irrespective of whether or not they have keratoconus or keratoglobus, they need yearly eye exams. They need to pay attention to whether or not their refractions are changing and they need new glasses frequently. And we need really more information, more clinical information and more research to be done on this group to know whether or not interventions like cross-linking at such a young age are appropriate and safe.
So would you say that the Jones Eye Institute is available for ATS patients if anyone would like to be seen?
The Jones Eye Institute is committed to helping patients with ATS. We want to grow the ATS clinic through the Jones Eye Institute and the Arkansas Children's Hospital to the point that patients recognize that this is a center of excellence committed to ATS. We invite all patients and their families to come and be evaluated and lend their information to our database so that we can characterize the findings in this group of patients, and hopefully this will lead to some publications that can really help patients and families make prognostic decisions about the future and know really which interventions work and what to expect in the future.
To date, the Jones Eye Institute ATS clinic portion has seen the most ATS patients of anyone else in the world. How does that make you feel, or I don't know, you're the world expert now.
Well, I don't really consider myself an expert. I'm just trying to learn, and I'm just trying to help Aiden and others like Aiden who really live with some degree of uncertainty. I think one of the greatest things that I can do is to help connect patients and families with resources and information that might be useful to them. And we're happy to continue to support this effort and to try and educate people as much as we can on what ATS does to the eye and how we can help people to keep their vision or improve their vision.
If you had a physician to call you, what advice would you give them? We didn't ask that before, did we? Do you have any advice for any physicians that would see someone like Aiden in their clinic? Should they send them to you? I don't know.
Yeah.
Fast.
ATS patients need yearly eye exams, and sometimes more frequently, particularly if the curvature of the cornea is changing or if they're changing their eyeglasses frequently. I would say that these patients could be followed by an optometrist or an ophthalmologist, but the key really is to have yearly or frequent eye exams to determine if the vision is changing and how rapidly it might be changing. As a part of those eye exams, it would be very helpful if they could have specialized testing, like obtaining corneal maps or scans that show the curvature of the cornea. And I would say that while these patients could be referred to our eye clinic, they don't necessarily need to be seen here. They just need to be seen in a regular and frequent manner.
Let's see. Any other questions that you don't think I've asked?
No,
I mean, you kind of covered that y'all are working on research and,
I could talk about that a little bit.
okay. So Dr. Warner, we heard that you guys are working on some research on ATS. Can you tell us a little bit about that and what your plans for the future are?
So our research project really came out of the ATS eye clinic that we did last year, and we wrote a paper characterizing the findings of all of the patients and carriers who participated in that clinic. And what we found, which really hasn't been described in the literature thus far, is that 100% of these patients have myopia. And many of them have corneal changes which suggest keratoconus or keratoconus-like conditions. So that really wasn't known. And to date, this is the largest group of ATS patients that's been examined, and we're really excited about publishing our results. And in fact, we've submitted that for publication.
Where can we find when it's published? Will you have it on your website, or will it be on a nonprofit's website? Where can others find the information once it's published?
So we hope to publish a link on the ATS nonprofit website, and of course we'll put it up as an announcement on the Jones Eye Institute homepage. But this is going to be published hopefully in a reputable journal, which will be indexed in PubMed. So anyone who has access to a computer can look up PubMed, which is a totally free database to search, which is maintained by the government, and you can put in ATS and ophthalmology or ATS and eye findings, and it will lead you to papers that will be helpful in determining what is known or what's been published about ATS.
You've done fantastic. Like for a dry run.
I feel like I just tripped all over it. But
No, my gosh,
You
it just
actually
flowed
sound
like
great.
butter. It was
Yeah.
fantastic. You interview people all the time, and he
Yeah, it was
always do
good.
a
That was
really
really
good job. Yeah. So you think of anything else that we need to, I mean, maybe get some footage with you and Aiden real quick, and then.
yeah, just take little short segments that make me sound smart, because, you know.
If you sound